I am Dr. Sandeep Jain, Head of the Department and Senior Consultant at Emergency Medicine, Sharda Care, Healthcity. When you have injuries, they can happen because of road traffic accidents, they can happen because of the falls, they can happen because of the assaults, or maybe during the sports injuries. Smaller injuries such as abrasions are nothing but when your skin gets grazed against a rough surface. You get some amount of bleeding, some pain, or maybe some burning sensations. What you can do is you can wash it thoroughly with the water, apply some antiseptic ointments such as sulfaramycin, and you can dress it. They usually takes 5 to 7 days to heal. In case the pain is severe, you might have to use medical aid, you might have to see a doctor to manage these patients. The other injuries are the bruises. Bruises, also called as contusions, are nothing but a bluish, greyish or the greenish discoloration of the skin. They are minor injuries caused because of rupture of the blood vessels within the skin surface. They can be managed with the help of ice packs. You can apply any painkiller sprays or the ointments to manage them. In case the pain increases or the swelling increases, please see your doctors. The third category of the minor wounds which we see in our daily practice are called as cuts. Cuts are nothing but a breach on the skin. They can depend on the superficial, they can go to the deep with exposed surfaces. If they are associated with the bleeding, you again have to wash together completely with the help of a running water, apply some antiseptic ointment like betadine, or maybe you can clean with Dettol, and you can dress it. These wounds usually require some amount of surgical procedures, maybe in the form of suturing, or maybe you require some amount of debridement. For that, you have to visit the nearest emergency department. Sprains or fractures, they are orthopedic injuries, usually seen after the sports injuries. Sprains are nothing but a break in the continuity of the ligaments which are responsible for maintaining the stability of the joints, while the fractures are the complete or partial tear in the bone surfaces. How you identify them? When there is exquisite pain, there is a swelling or the difficulty in movement of this part, or maybe their deformity, you may be suffering from the sprains or the fractures. How we manage them is a simple mnemonic. You can remember it with the name of RICE, where R is rest. You have to rest the part. I is immobilization. The part which is affected needs to be immobilized completely with the help of a splint. These splints can be made out of wood sticks, bamboo sticks, cardboards, or maybe just folded sheets of the papers. When you stop the movement of these parts, they stop your swelling, they decrease your pain, and they also prevent from the blood loss. The third part is compression. Ice compression is used for the acute care injuries. Fourth component is elevation. So when you elevate the limb, it reduces the venous pooling and reduces the further swelling. So remember, for the sprains and the fractures, use RICE. We at Sharda Care Healthcity are fully geared up, fully prepared to manage any kinds of trauma. Emergency department at Sharda Care is 24/7 ready to help in case anything is required to manage any kind of trauma, be it road traffic accidents, be it small injuries.